Hello, my name is Terry Gill, and I'm a Senior Emergency Services Coordinator for the California Department of Public Health, and I'm responsible for leading some of our department emergency operational response planning efforts. I'm excited to share with you the importance of planning for emergencies, particularly for those involved in public health, as every emergency has a public health component. State agencies, local governments, and other stakeholders must be prepared to respond in emergencies that occur in their areas of responsibility, and that response has to be scalable, from a minor event to a catastrophic earthquake. Between 1950 and 2009, California experienced over 394 major emergencies, which resulted in over 1,200 deaths and 25,000 injuries. Emergency planning can help to reduce our vulnerabilities to disasters, and preparedness activities ensure that resources are available for an effective response. Generally, emergencies start out as a local incident, and the mutual aid system is set up to rapidly respond to local government requests for assistance. The state is divided into 6 mutual aid regions and 3 administrative regions to support this process, as you can see on this map. It is critical that agencies connect to their local emergency management system to ensure that they receive alerts and can request assistance in an emergency. Assistance requests flow up from the local level and resources flow down, as you can see on this chart. Over the past 2 years, the California Department of Public Health has been engaged in a process to update our Emergency Operations Response Plan, and we're now entering Phase 2 of the project, which is to update and revise Center Program Emergency Operation Response Plans. Our department plan outlines how we will respond in an emergency and what triggers the activation of the department's emergency response structure. Those triggers include notification that an emergency is likely or imminent, a local or state proclamation or a federal declaration, a request from the Governor's Office, the California Health and Human Services Agency, or the California Emergency Management Agency. A local jurisdiction has requested our assistance to support an emergency response. Public health impacts escalate, increasing the number of people impacted or increasing morbidity and mortality. Coordination across center programs and/or with external agencies is required. The emergency impacts CDPH operation. Center program plans support department operations and describe how programs operate in an emergency. Most emergency activations start with notification to the CDPH duty officer about an emerging incident. Last year, the CDPH Duty Officer Program received over 1,200 notifications of urgent incidents in California, which required notification for CDPH programs. One of the most recent incidents was the Japanese earthquake tsunami radiation event. The CDPH duty officer was notified at 11:43 p.m. on March 10th that an 8.9 magnitude earthquake had happened in Japan and that a tsunami had been generated. This galvanized the department into action. Alerts were sent out to executives, local health departments, and other stakeholders. After the tsunami hit, an incident turned into a radiological event. The department quickly activated the Joint Emergency Operations Center to handle more than 1,600 calls that came in from the public during the next week. Their concern was whether or not radiation was a threat to California. This incident also had an impact on WIC programs. And now I'm going to turn it over to my colleague Dana Henderson to describe the impact to the WIC programs and also give you more information about Phase 2 of Emergency Operational Response Planning. Thank you.
Thank you, Terry, and hello to all of the local agency representatives attending this month's regional meetings. As my colleague said, my name is Dana Henderson, and I am an emergency analyst with the Center for Family Health. My role is to work with each of the 4 programs in the Center for Family Health and develop their all-hazards emergency response plans in partnership with program staff. These plans not only outline how center program staff will respond to an emergency, but will also help CDPH staff prioritize our activities so that we can help support you, the local agencies, in the event of a disaster. As Terry mentioned, the recent tsunami had an impact on some of the WIC clinics near the California coast. This included clinics in Humboldt, Mendocino County, San Diego, and Crescent City. In response to the disaster, clinics in these areas had to temporarily close or reschedule appointments with participants. Though damage was minimal and WIC services were not postponed for a prolonged period of time, This event highlighted the importance of having the appropriate emergency response plans in place, both at the CDPH WIC and local agency levels. The CDPH WIC program was designated as a priority group for emergency plan development by the Emergency Preparedness Office. WIC was chosen due to the fact that our program serves some of California's most vulnerable populations. These individuals and families will be at greater risk in a disaster, and we will need to be prepared to help them maintain access to WIC services. WIC also needs to be prepared to aid those individuals and families who have become eligible for WIC services because of displacement as a result of the disaster. As part of our charge, I will be working with a team of staff here at CDPH to develop a comprehensive all-hazards plan for WIC. The plan will be based on a template developed by the CDPH Emergency Preparedness Office and liaisons from each of the centers within the Department of Public Health. The template follows all current federal and state regulations and requirements. This plan is different from the CDPH WIC Disaster Response Plan in that it focuses on all elements of a disaster, not just ISIS, VWICs, and IT recovery. This plan is also different than the Facility Emergency Response Plan, either here at the state or at your local agency offices, in that instead of addressing evacuation or sheltering in place, this plan addresses how we will continue to provide our services under emergency situations. The process for developing our WIC Emergency Operations Response Plan includes defining what an emergency response would look like for WIC and determining policies and procedures that will go into effect during an emergency. The process also includes getting information from our most important stakeholders, the local agencies, and incorporating recommendations from USDA and other emergency response plans that are currently in place. Our Emergency Operations Plan is also taking information obtained from lessons learned after the tsunami and incorporating them into our plan. In order to ensure that CDPH WIC can develop the most comprehensive emergency response plan possible and assist and support local agencies in a disaster, we have put together a survey for the local agencies to fill out. This survey will be addressing questions about current plans that local agencies have in place, what the local agencies' expectations are of CDPH WIC, and how the local agencies think they will need our help in a disaster. By filling out the Emergency Preparedness Survey, you will be informing us of your needs and expectations during a disaster, which will help us be better prepared to provide support in the form of staff, supplies, and communications. We ask that you set aside time with your staff and fill out the survey, keeping a real disaster in mind, such as a fire, flood, earthquake, landslide, infectious disease outbreak, or chemical spill. When you answer the survey questions, think about how it is that you and your staff will be able to provide support to WIC participants and the surrounding community. This includes being individually prepared at home and at work with an emergency response kit so that you know your family and loved ones are safe before you are responding to work. Thank you ahead of time for filling out the local agency emergency preparedness survey and for taking the time to watch this presentation. I look forward to getting your survey feedback and to working with you.